Molly, thank you so much for taking the time with me today to tell me about your work at Microsoft. I really am not very familiar with some of the health initiatives within Microsoft, so I hope you can just start high level for me.
Sure, yeah. No, thank you so much for having me. It's great to be back in person. So at Microsoft, I've been there almost 9 years, and more recently, we've really been focused, obviously, the past couple of years on helping our health provider customers as well as our payer customers navigate through the pandemic and really move towards a digital world, which we were all on the verge of doing with them prior to the pandemic. But I really think COVID accelerated the adoption of that transformation as well as technology. And with specifically to our team at Microsoft, I represent the industry team, and so we have a lot of clinicians on our team, as well as former CIOs, hospital and health plan subject matter experts, and we're really focused on a couple of different things. One is the Microsoft Cloud for Healthcare platform to really enable such things as remote patient monitoring, for example, in the hospital or in the home. And so we're working with many different companies, actually from startup companies all the way up to vendors such as Epic and Cerner and Allscripts and the large EMRs to really help them build out on our platform so that their customers really realize the value and understand as they move forward how to utilize the technology to really achieve what we used to call the quadruple aim,
Right.
but moving more towards the quintuple aim.
Oh, wow. I have not heard this one.
Yes.
What's the fifth
The
aim?
fifth aim is health equity.
Okay. When we talk about, health initiatives with an enterprise company like Microsoft, we talk about ecosystems and platforms. It's easy to be very macro and high level, and yet at the end of the day, we're talking about changing the lives of individual patients. And I wonder if for you as a leader in this space, if there's a patient or a patient profile that just comes to mind, it sticks with you and keeps you moving forward.
Yeah, that's a really good question. I think being in healthcare for 28 years, starting my career in pediatrics and NICU and cardiovascular nursing, I'm very passionate about at the end of the day, aside from working for a massive tech company, is to ensure that the patient journey throughout the health system, whether they're in the hospital, in a clinic, or at home, is seamless. And obviously we're not there yet. Or we wouldn't be here today, as well as our clinicians. So I'm very passionate about them. And I really think about some of the more chronic patients, such as the NICU babies who might be there for months at a time, and thinking about how we can involve the family, the parents in their care throughout that process, in the decision making, in the daily rounding, as they prep to go home. Sometimes these infants can be medically fragile, so they'll need support at home. So not just that point in time in the intensive care, but what it looks like for them, 1 to 2 months at home, as well as, quite frankly, their entire lifetime, because they might have specific needs. So that keeps me grounded, I think, in what I do every day to really I guess for me, it's remembering why I get up every day. It's not necessarily for, a massive tech company, but really for the people that can benefit.
That's an intensely, personal experience that you went through. That you refer back to those, those times as a NICU nurse, and a lot of health tech startups, they don't have someone on staff who has that experience. And I'm sure people you work with don't have that personal experience. I'm kind of curious how you cultivate a culture that really puts the patient first and use your past in your current teams.
So I think for me, it goes back to, I think, diversity and inclusion. I mean, I know that's a term that's thrown around a lot today, but for me, thinking about even my own journey within medical device and tech companies, having an inclusive culture where you're bringing in the end users, the clinicians, the patients into the design and development process, not just the deployment. They really need to be giving their thoughts and feedback, and whether it's a clinical specification or a technical need, throughout the process, so that when we come to the table with that end solution, it makes sense.
Yeah. And you're able to do that? Microsoft brings in doctors and nurses?
Yes, I mean, we do that. We've definitely, as we continue to go deeper into industry, it's something, actually, I'm missing a call right now with our engineering team to be here, but that's my passion, is to make sure that as we think about product development, the process makes sense, not just for the engineers, but for everyone involved, because that way you're going to end up with a win-win.
Yeah. What's next for Microsoft Cloud for Health? If we look out a year, 2 years, what do you see as the sort of exciting new potential?
Yeah, I think, right now we've really started to penetrate the provider market as well as a little bit of the payer market. I think for us at Microsoft, it's growing that ecosystem of our partners who can take it to the 100% to the finish line. And I continue to see that expanding within, for example, med device and life science companies. But I think really for now, as we continue to focus on the transformation, what we need to demonstrate is, and show our customers, is how it's worked well for some of the systems and kind of what the kinks are. Really, because in healthcare, there's always FOMO, fear of missing out. They want to be first, but they might not necessarily want all the risks involved. So I'm super excited to continue to see the transformation of technology within healthcare, and really it taking a back seat and going back to what I talked about before, allowing those clinicians and patients to move through the system seamlessly.
Yeah. Microsoft is such a global brand. It's sort of, as a brand, it's taken on a life of its own, for better or for worse. And I'm curious, as Microsoft lays foundations in health, how do you want to be known as a brand? And I guess a corollary to that is, what's something that people might misunderstand about Microsoft as a brand?
So I think, for me, and I would say even all the way up to Satya, and I've been at Microsoft almost 9 years, as I mentioned. He's been the CEO for 8 years, I think 2014. And what's important to me, and I think the company, is that we really want to partner with our customers. We don't want to compete. We want to transform with them. And we know that as a tech company, we're not going to bring all of the solutions to the table, but it really works best when we come together collectively. We don't want to own anyone's data. And really, as a brand, I think we want to be a trusted partner. And I think if you think about Microsoft in beyond just the healthcare environment, cybersecurity, privacy, trust, those are really some of our core foundational pillars within Microsoft and our core values. And that obviously transcends down into health.
Well, Molly, thank you so much for taking the time with me today, helping us understand Microsoft's interests in health and kind of where you're going next, and excited to see what you do this year.
Great. Thank you so much for having me.
All right. Be well.